on the United States Senate to take the baton and bring this effort to the finish line on behalf of the American people. And I'm absolutely confident that they will. And I'm equally convinced that on the day that we gather here at the White House and I sign comprehensive health insurance reform legislation into law, they'll be able to join their House colleagues and say that this was their finest moment in public service. The moment we delivered change we promised to the American people and did something to leave this country stronger than we found it.
Welcome back to Hardball. President Obama says it's all in the Senate's hands now. So what's going to happen over there and how long will it take if it ever gets done? In a moment, Republican Senator John Barrasso of Wyoming will be here. But first, North Dakota Democratic Senator Kent Conrad, who's chairman of the Senate Budget Committee. Senator Conrad, this gets trickier and trickier. Senator Joe Lieberman, your Democratic colleague, over the weekend said no way at all will he vote to even allow the vote to come to a vote for final passage if the House bill includes a public option. What does that do to the calculations of the leadership and yourself?
Well, it's always been the case that public option it was hard to see how there were the votes for it in the Senate based on the public announcements of positions of individual senators, including Senator Lieberman and Senator Snowe. So that still remains up in the air. I will say that the House made a major change in not tying public option to Medicare levels of reimbursement, because those of us who represent low reimbursement states simply could not accept that, could not vote for it, because it would have worked such an extreme hardship on our states. And they changed that in the House. It is no longer tied to Medicare levels of reimbursement.
Well, is it going to pay enough for your hospitals?
Well, certainly Medicare levels of reimbursement never would. In our state, Medicare levels of reimbursement are well below actual costs.
Right.
That's why tying it to Medicare levels of reimbursement would be so devastating. It remains to be worked out. And I'm hopeful as we go through this process we can reach a conclusion that does manage to get 60 votes and do it in the right way, because we've also got to reduce the deficit both in the near term and the long term. And the House bill is relatively good in the short term, but the long term does not have the savings that the Senate bill does, at least the Senate finance bill. So there's going to be a need for people to come together and to reach a conclusion.
Okay, on a non-quantitative measure, on the issue of quality or values, the issue of abortion, what will the impact be in the Senate side of that House-passed amendment, which basically takes abortion coverage out of the bill?
You know, I've been listening to your conversation with the two previous guests, and I think you've captured it, Chris. This is yet to be worked out. What we know for certain, if there is taxpayer funding of abortion in this bill goes down. That is the reality. That was the reality in the House. That's a reality in the Senate. So there has to be a way of working this out so that we are left with something people can support.
Why can't the geniuses on these staffs up there, I used to be a staff member, but maybe I wasn't the genius that was required, but isn't there some way to separate out so that people who are taxpayers can support a health care plan without getting involved in the individual decision, which is a guaranteed right under this Constitution to choose an abortion? You don't get involved in that decision. It's totally that woman's choice, that you're not subsidizing it or taxing it or anything. It's a neutral choice as far as you're concerned, which is what most Americans, I believe, are comfortable with if they support abortion rights. Even those people say, let the person pay for it. Now, how does this get involved here in this whole sticky mess of health care? People say, well, it's just like any other health care procedure. Well, it isn't just like any other health care procedure. We wouldn't be debating it. We don't have national debates over kidney removal or anything else like that. This is unique in our culture, in our value system. So how do we solve it?
You know, we got to remember, this is not an abortion bill. On the other hand, this bill will not advance unless people are convinced that there is not taxpayer funding for abortion. As you know, we have the Hyde Amendment. The Hyde Amendment has been in place for more than 30 years, and it assures that taxpayer funds do not go for abortion. I think this is something that is yet to be solved in a way that is acceptable, and a lot of additional work is going to have to be done.
Okay, thank you very much. Ken Conrad, Senator from North Dakota and Chairman of the Senate Budget Committee. By the way, here's Senator Joe Lieberman on Fox News yesterday. Talk about a barn burner. Here he is. Let's listen.
If the public option plan is in there, as a matter of conscience, I will not allow this bill to come to a final vote, because I believe the debt can break America and send us into a recession that's worse than the one we're fighting our way out of today.
Well, as a matter of conscience, Wyoming Republican Senator John Barrasso is an orthopedic surgeon. Senator, thank you so much for joining us. Are you going to vote for any health care bill, or is this just for the Democrats to debate?
Well, the Democrats are the only ones that are doing the debating right now. I want to vote for health care reform that is patient-centered, not government-centered, not insurance company-centered. There is a right way to do this, and right now I look at this bill as being the totally wrong way to address the health care needs that our nation has.
Republicans have been in power for 8 years before this presidential election. You've had ample opportunity under previous administrations when you've had control of the Congress. Under Reagan. Where was the Republican health care bill then? I mean, everybody talks now on the Republican side how woulda, coulda, shoulda, maybe what, might have done and didn't do it. How come you never did it when you had the power to do it? Now you say we've got a better alternative. I don't get it.
I've only been in the Senate for 2 years, and from the day I showed up, I was talking about the way to put patients at the center, allow people to buy insurance across state lines. We know from a study, Chris, that 12 million Americans would be able to get insurance affordably if they could just buy across state lines and then give them the same tax breaks as the rest of the country, as big businesses get. And I've been talking for years about the fact that half of all the money we spend on health care is on 5% of the people who eat too much, exercise too little, and who smoke. And even Front Page USA Today the other day, a third of Americans are at increased risk for cancer because of obesity. Yet there is nothing, Chris, in any of these bills that really ends up putting the patient in the center and giving that individual patient an incentive to stay healthy, get their diabetes under control or their weight under control. And there's nothing that really deals with the lawsuit abuse. A loser pays, or a number of different ways that you could deal with this. All the defensive medicine,
okay,
that's actually been scored at $52 billion.
But the Democrats are in bed with the trial lawyers, so they're not going to do anything.
Well, does that mean it's the right solution for a country?
No, I'm just telling you. I'm trying to deal with facts of life around here. I'm just trying to figure out how health care gets built when you have a Democratic Party that's owned by the trial bench. It just is. A Republican Party that seems to be in bed with business and the insurance companies and really doesn't want to do anything. And every time you're a party, you say you're not responsible. And I haven't met you before, but everybody says you're a great guy. And obviously your commitment to medicine is real and a lifelong commitment. But I haven't seen your party, which you're in, do anything. Ronald Reagan back in the 60s talked about alternatives to Medicare. He didn't want an alternative. Your party never wants an alternative. What you want to do is stand on the sidelines and make catcalls against the Democrats when they try to do things like civil rights and things like that. That is a problem. Are you proud of your party's record on health care?
I think both parties have a long way to go on health care, and we ought to put patients first. Look, your governor, Ed Rendell, was on Meet the Press yesterday, and he said there's probably 80% of the things that we can agree on, a step-by-step process.
Yeah, but he's not going to touch. He is not going to touch tort reform.
Well, if there's 80% of the things that we can agree on, we ought to
that's one thing. He's a good guy in many ways, but all parties seem. The trouble with the political parties, Senator, is you got to buy the blue plate special. If you're Democrat, you got to buy all this stuff. You got to buy card check, and you got to buy the trial lawyers, and you got to buy their whole kettle of fish. If you're a Republican, you got to buy the full mooners on the cultural right, the wing nuts. They all come aboard too. When are we going to have a political party that's absolutely sane and absolutely operates in the national interest?
Well, I'm trying to work in the best interest of the people of Wyoming. I've been the medical director of something called the Wyoming Health Fairs, where we blood test 50,000, 60,000 people a year so they know their cholesterol and they get their.
I wish you and NZ.
And it's preventive.
I wish
and the
you.
state,
You and NZ are both from Wyoming. You're both great guys. I hear great stuff about you. You and NZ, the former CPA, you're both good on health care, and yet you're not partners in this health care bill. And I don't understand why this isn't bipartisan, with at least 5 or 10 Republicans like you aboard, why they couldn't reach agreement, why you couldn't reach agreement. Is there an answer to that? Why
Well,
is this a
been
Democrat
invited
bill?
in. I've had suggestions for the president. He hasn't listened to me or to Tom Coburn, who's the other physician. There are only 2 physicians in the Senate, and I've been taking care of families in Wyoming for 25 years. I know the consequences, Chris. I know the consequences of a big health care bill
Coburn loves to be the odd man out. Coburn loves to be the odd man out. You may want to join him. He's not a joiner. Hey, thank you so much for this, Senator Barrasso. It's nice to have you on the show. I've heard great things about you. It's too bad you're not aboard this health care bill.